Today, over 20 million Pakistanis suffer from kidney-related diseases. Each year, 200,000 die as a result of lack of facilities. Around 6 million of the total Pakistani population also suffer from chronic liver diseases. Sindh Institute of Urology and Transplantation, which started operating as an 8-bedded unit in 1970, is now one of the largest institutes in the region, providing free medical care to thousands of patients annually. It is the only institute in the country to provide a high standard of care, life-saving treatment, kidney transplants, etc. to people from all over Pakistan, totally free of cost. How does SIUT manage to do so? SIUT thrives on a unique concept of public health care, a partnership between the community and the government. One example of this partnership is the Diwan Farooq Medical Center, the new premises of SIUT. This center has all the state-of-the-art facilities available under one roof. While the government of Sindh provided the land for this center, the building itself is a donation from a local philanthropist family. This is the largest center in the region, providing free services in urology, nephrology and transplantation. SIUT is a model of public health care among all developing countries. The treatment success rate here can be compared to that of any other institution in the world. The kidney transplant department performs 3 transplants a week and has carried out 1,600 transplants so far. SIUT also provides dialysis facilities completely free of cost. It has 100 dialysis stations where 90,000 sessions take place in a year, which is 25% of the country's total dialysis. This can cost 18 crore rupees in the private sector. The lithotripsy unit has 3 types of lithotripters that are used according to the location, size and type of stone. Each lithotripsy session costing over 15,000 rupees in a private hospital is done totally free at SIUT. Lithotripsy of over 1,600 patients are performed annually. Apart from these services, SIUT has a 24-hour lab, electronic microscopic unit, outpatient department, medico-social and rehabilitation services. The sophisticated radiology unit is equipped to provide facilities such as X-ray, gamma ray, ultrasound, CT scan, angiography, MRI, and interventional radiology. In 2001, GI services were introduced at SIUT. This was a first step towards the initiation of the liver transplantation program in Pakistan. The ambitious goal was achieved when Pakistan's first successful liver transplant was performed at SIUT on 25th November 2003. 6-month-old Suhaib from Rawalakot, Azad Kashmir became the first patient in Pakistan to undergo a successful liver transplantation at SIUT. Suhaib's maternal uncle donated a portion of his liver for the operation. Now Suhaib is 18 months old and is a happy, healthy child. The GI program comprises 2 OPDs per week. Inpatient services including endoscopies and ERCP, GI surgeries and liver resection. During the last 5 years, SIUT has been faced with a 100% increase in the patient population. In 2003, around 350,000 patients received free treatment in different specialized units. This significant increase in the number of patients has led to a tremendous increase in expenditures as well. Although SIUT spends 80% of its funds on patients' care, it is facing acute financial problems in running the institute. SIUT has spent its entire endowment fund of rupees 227 million in meeting the day-to-day expenditures of patient care. Now with the costs mounting and the number of patients increasing, it has become a challenge for SIUT to sustain its regular activities. The dedication of Dr. Adibul Hassan Rizvi and his team has bridged the gap between the community and the government, bringing them together to work as partners for a worthwhile cause. At present, The running budget of SIUT constitutes over 400 million a year. Each dialysis session costs about $50 in a country, where the annual per capita income is about $450. The treatment, which very few can afford, is done totally free at SIUT.
In many other parts of the world, there are only two options: pay or die when it comes to disease. Can we create a third option and can be proud that we don't let anybody die because he cannot afford to live?
However, as recognition of SIUT's services, conscientious members of the community have continued to support the Institute. Since 25% of SIUT's patient population comprises of children, the pediatric unit of SIUT caters to the special needs of children suffering from urological, nephrological and GI-related problems. As part of SIUT's academic program, currently 45 postgraduates are under training. So far, more than 750 doctors, nurses, technicians and technologists have been trained here. SIUT is playing a vital role in training doctors and technical staff from SAARC and other developing countries as well. The Rehabilitation Center at SIUT helps transplanted patients to lead productive lives by organizing regular training classes in technical and vocational skills. Patients transplanted at SIUT have represented Pakistan in several international transplant games and won many medals. To bridge the increasing gap between demand for treatment and availability of facilities, SIUT is now in urgent need of financial support. At SIUT, we don't let them die because they cannot afford to live. Donate generously to a gift of life. Visit our website www.siut.org.